throat swab culture is a medical lab test. Look at this picture, shows that what is a throat swab culture involves taking a sample from the back of the throat using a sterile swab. The sample is then placed in a cultural medium that encourages the growth of any bacteria or fungi present. After a specified incubation period, the culture is examined for the presence of pathogens. Used for 1. Diagnosis of infections to identify bacterial infections, particularly streptococcus infections. 2. Determining appropriate treatment, helps determine if antibiotics are needed and which ones may be effective. 3. Detection of fungal infections can also be used for identify fungal infections in the throat. 4. Guiding further testing. If further tests are inconclusive, a throat culture can provide additional information. Who do or need of this test? 1. Symptoms. If a patient presents with symptoms such as sore throat, fever, swollen lymph nodes, or difficulty swallowing, a throat culture may be warranted to determine the underlying causes. 2. Complications. Identifying the types of infection can be help prevent complications such as rheumatic fever associated with untreated strep throat. 3. Epidemiological surveillance. Monitoring the prevalence of certain infections in a community. How long for my results? Results can typically be expected in 24 to 48 hours. However, some bacterial cultures may take longer to grow and identify, especially if they require specialized media or conditions. What happens during the test? 1. Preparation. The healthcare provider will explain the procedure and may advise avoiding certain foods or drinks before the test. To sample collection, a sterile swab similar to a long cotton swab is gently rubbed over the back of the throat and tonsils to collect a sample. It may cause slight discomfort or gagging, but the procedure is quick, usually less than a minute. Three, handling of the sample. The swab is placed in a sterile container and sent to the laboratory for analysis. Preparation of this test. 1. No food or drink. Patients may be asked not to eat or drink for a few hours before the test to avoid contaminations. 2. Medications. Inform the healthcare provider about any medications, especially antibiotics, as they can affect the test results. 3. Symptoms. Be prepared to discuss symptoms and medical history with the healthcare provider. Risk factors. 1. Discomfort. Some patients may experience mild discomfort or gagging during the swab collection. 2. Infection. Although rare, there is a slight risk of introducing bacteria during the sampling. 3. Bleeding. Minor bleeding may occur if the swab irritates the throat, particularly in those with inflamed tissues. Result for negative results indicates that no pathogens be detected. If symptoms persist, further investigation may be needed. Positive results confirms the presence of a specific pathogens. The healthcare provider will disclose treatment options based on the organism identified. No more. 1. Follow up depending on the results. Follow up tests or treatment may be necessary. To antibiotic sensitivity, if bacteria are identified, additional testing may be determined. Which antibiotics are most effective? 3. Home care. Patients may be advised on home care measures for symptom relief while waiting for results, such as warm salt water gargles or over the counter pain relief. Thank you. Have a nice day.